All right. Well, welcome everyone. This is the first speaker series of the 2026 year, and it's been a little while since we've been able to have a speaker series, so we're really pleased about this particular one because this is a homegrown speakers. So tonight we're going to talk a little bit about One Health, what is One Health, and how it pertains to our work in Tanzania. And coming up, we're going to have probably another second speaker series in April 22nd. I am attending the Conference on Retroviruses and Opportunistic Infections, which is the big AIDS meetings in February. I think it's going to be a pivotal meeting because we have some enormously important advances that have been made in dealing with HIV/AIDS. And so I'll be doing a review from that conference in April. After that, we'll also probably have another one in June, a topic to be announced, and perhaps another one in the early fall of next year. So if you check the website periodically or you're on our email list, those announcements will come out so you can join us. Of course, you can also watch these speaker series. They're recorded and they're on the website. So without further ado, it is my pleasure to introduce the two speakers. I'm going to just give a little introduction after them about the topic. Diane Tang is a wonderful person who came to the United States when she was a child. She immigrated from the Philippines. She attended UCLA and graduated with degrees in entertainment and worked in that for a while, but decided to pursue her true love, which was veterinary medicine. She attended Western University, where she received her DVM in 2011, and then did an internship at Animal Specialty Clinic. She has established a practice with Dr. Michelle Zorian as well, and they have been working together over many, many years. We were privileged to meet them quite a long time ago, and they are just extraordinary people, deeply dedicated to the welfare of both humans and animals, and certainly have gone with us on several trips now to Tanzania, and we're just really honored to have them as part of our organization and work. Diane lives in Las Feliz with her wonderful husband, Paul, who also has attended one of our trips, and she has two lovely little daughters and a grumpy man dog. So she's just a deeply devoted animal person, and we're really delighted that she's here tonight to talk about One Health. Dr. Zorian is equally talented and a delightful person. Michelle attended Kansas State University, where she graduated in 2003 with her doctorate in veterinary medicine. She also did her internship at Animal Specialty in Hollywood, and she started a general practice and has continued working in that, although she also has experience in urgent care animal medicine as well. She lives in Palm Springs with her wonderful fiance, Jerry Bausman. Jerry and Michelle have been part of our project for a while. Jerry is a veterinary surgeon, really skilled a clinician and a wonderful person. And just like Diane, Michelle is deeply devoted to the Phil Simon Project, and she has actually joined our board. Dr. Tang is also on our scholarship committee. So we're just really honored to have them as part of our organization and to talk about One Health tonight. So what is One Health? One Health is not a thing. It's really a concept. And I think it's become very clear that we live on a very small planet and that all of us, animals, plants, climate, humans, are deeply interconnected, and that when certain types of things happen in one community, an animal community or in a human community, that can have impact on all of the surrounding environmental issues and communities that are affected by that. So we're deeply, deeply integrated, and I think it's important to think of it as the totality of a concept that has many facets. The idea of One Health was put forth by the veterinary community, which is interesting. They were brave enough to not silo themselves in their own little world like medical doctors tend to do sometimes, and reached out to the human medical community and really helped create in the 1960s the idea that One Health is an important thing that we need to think about, and that the planet is a very small place where even changes in any kind of environment or community can make a difference on other aspects of it. So it's really a lot of professional type people working together and communicating with each other. I think that's perhaps the most important aspect of this. Again, this just sort of shows all of the different things that we consider to be part of a One Health doctrine. And it is, of course, an international endeavor. There are many organizations that are devoted to this. This is a concept and a philosophy that is really deeply appreciated and embedded in countries where there are limited resources. And Tanzania certainly has spent a lot of time focusing on the importance of One Health projects and incorporating that into their education of both medical doctors and veterinarians, as well as environmentalists, biologists, and certainly industry and agriculture. So why is it One Health important? Well, as I mentioned, it's the interconnectedness of the planet. It's assessing the importance and impact of animal-human interactions. It has implications with climate and environment and animal-human proximity. We know that as environmental factors influence the migration of animals and the interface between humans and animals can change because of this. Growth populations in both humans and animals, or growth decline in animal populations, are deeply integrated. We know that habitat destruction has an impact on the health of different bioecosystems. And of course, recently we experienced the emergence of global pathogens, but that's happened all along as environmental factors come into play, and you have an interface between animals and humans. That can lead to zoonotic spillover events. HIV, of course, is a zoonotic infection, so that's a very good example of that. And there certainly are many other zoonotic events that happen. Ebola and Marburg virus are of concern as well, and perhaps even SARS-CoV-2. We know that One Health is important as we move forward with the use of antibiotics and the overuse of antibiotics and the pressures that they may put on that in industry, agriculture, and human medicine, and how that might actually impact the emergence of antimicrobial resistance in animal populations. The planet is a very small place. You can get around very quickly, and you can go from a very isolated area to a very urban and populated area, shorter than an incubation period for an infectious disease. So that really impacts health as well. Of course, sociopolitical factors can really have an important impact on the environment and also on human and animal populations, as do agricultural practices and ways of vector control. So it's really a complex but very important totality of issues. And we're going to talk about that tonight with in a little bit more depth and how that pertains to our own project in Tanzania. The CDC has some information on this if you're interested, and I know that Dr. Zorian and Dr. Tang have also some references if you have a further interest in this. But it's a fascinating topic, and I am anxious to hear what they have to say. So I'm going to stop sharing my screen, and I think that Dr. Tang is up first.
Yeah, hi guys. Thank you so much. I'm a little nervous. I've never have had a big talk like this before. Um, and I would probably say, Kim did a very great introduction to One Health. I think that was a better introduction than I had when I was in veterinary school. But I will tell you that while I think will agree with me, I'm not a One Health expert by far. I definitely did not, dive deep into this during schooling or anything like that. But I would say that just basic, kind of on the basics of my education, or not even the basics, just the ethos of veterinary medicine focuses on One Health, even if that wasn't what we called it back then. And so, I think the idea that the environment and human life and animal life are connected was just the basis of everything that we learned, and it kind of just turned into the way that we saw the world. And I am going to see if I can do this correctly, share my screen really quickly. I can show you here just based on, so this is actually our veterinarian's oath. This is the oath that we take when we graduate from veterinary school. Obviously, we swear to use our education to promote animal health and welfare, prevention and relief of suffering, but also to conserve animal resources, promote public health, and even the advancement of medical knowledge. And I think all of that kind of encompasses what One Health stands for. It's a relatively new concept. Like I said, in veterinary school, I didn't hear about it. I don't think Michelle did either. But we always had this idea of comparative anatomy, comparative medicine, comparative physiology, where, we would learn the basics, kind of what 90% of everybody else, every kind of species on this planet was kind of did, and then that other 10%, that's kind of the comparative part of things. Um, and I think ultimately that is just the way that we looked at the world. And so when Kim asked us to come along and figure out how we can kind of advance this concept, it really we kind of just naturally did it just because that's what we've been doing all this time. Um, I think veterinary medicine is kind of embedded, or I guess veterinarians are part of all of this. Um, when we look at kind of how the world works, right? I think for what how we see veterinary medicine in One Health, I think the most obvious answer we hear about is probably things like zoonotic diseases, like Kim had mentioned. You think about the big diseases that are transmitted by animals, rabies, for example, in small animals. You see these movies like Outbreak, where, or even like 28 Days Later, where the basis for the infection always starts from some infected animal. That this is actually kind of a true story. This is how a lot of diseases are spread among the world. Um, One of a good example, for example, is West Nile virus. I mean, we all have seen it before. This is a transmission cycle. We need a bird, an infected bird, to be fed by a mosquito that then spreads to horses and to humans. And so, again, here it is, where animals and humans are connected. Very fun story. One of my veterinary professors at Western University was actually instrumental in identifying West Nile virus back at the Bronx Zoo in 1999. And she actually told me a personal story about how that happened and how, identifying this pathogen and all these dead birds happening at the Bronx Zoo set about this pathway to identifying this virus. And because of that, because of her, I guess, like determination to identify, to prove that this was happening, she managed to create this interdisciplinary field where they were able to identify and create a vaccine for both humans and horses at the same time. So it's really cool the way that this all kind of connects to each other. I would say, don't forget, mosquitoes also animals. So you don't think that, you don't intuitively think these insects are part of the process, but there's multiple kind of animal processes at play here. Another one, Zika virus. This is a big deal back in the mid 2010s. Again, non-human primates getting infected and then passing those infections on to mosquitoes. So, I mean, the interplay of human medicine and animal medicine is so connected with each other, that if you don't look at them together, I feel like we're missing the point. I would also like to mention, the environment plays a factor here too. I'm probably going to talk about this a little bit more later, but climate change has been a huge factor in the spread of these diseases. Even just here in Los Angeles, I've seen a much kind of a huge increase in that Aedes mosquito, the ones that transmit Zika virus and dengue virus and all these crazy diseases that you always think of at just tropical climates. So the change in climate is allowing for the spread of these new vectors into new locations. So, I think ultimately, I think One Health is necessary for us to understand the world and for us to take care of ourselves and each other. And if you don't look at all of these things together, I think you're probably going to miss something. And ultimately, that's probably how, these big epidemics start, is we don't maybe take it seriously enough. Um, so yeah, so that's kind of the way that zoonotic diseases are connected. What I don't think people think of otherwise in veterinary medicine is the connection of animals to things like what we eat and how that works. Production medicine is a huge part of it. Making sure our animals are safe during our rearing of them, whether it be for meat, for dairy, for products, for fiber. is really important because, there are things that can be passed on through all of these products. And so, it's really important, I think, to understand that all these are connected together. The environment that these guys are raised in is so important, making sure that the wildlife in the area doesn't kind of become reservoirs for diseases that can then be passed on to animals or then can be passed on to humans. I know I think it was the mid 90s or the late 90s, up in Michigan, they were having a huge problem with white-tailed deer carrying bovine tuberculosis, and it decimated the meat and dairy cattle up in that area. And so, identifying how these white-tailed deer were transmitting these, becoming a reservoir and transmitting the disease back to them was really important to keeping that production up and not decimating an entire industry in an area that really needed it. So ultimately, I think, we have a responsibility to taking care of our environment and taking care of all the species around us, to keep our planet going and to keep our civilization going. I've said this a few times and I still kind of believe it, what humans are doing to this world, ultimately what it's going to do, what it does is actually just destroy the things around us. Earth is going to continue on, but if we don't understand the connection between all these guys and start taking care of all these little pieces of the world, we might be left with something we're not happy with.
So Diane had a question when you're talking about some of the overlap between industry and agriculture, and the bovine tuberculosis issue, which still is an issue especially in some underserved countries, but here in the United States occasionally as well. But it certainly brings to mind what we're kind of worried about with the H5N1 pandemic that's going on among birds in particular, but also affecting many, the dairy cattle industry here in California. And it has spilled over to a certain degree in patients that have high risk exposures, humans that have high risk exposures, dairy workers and so forth. But of course, I believe that a lot of the vets, and especially in LA County, had some issues with cats that had H5N1 and that had been getting raw milk and raw meat and things like that. And it's kind of an interesting, maybe you could comment a little bit on things that are sort of in our own backyard, that you don't have to go out and find these things. They kind of come to you. And I think one of the interesting things, certainly with the mosquito situation, I think that's a good example of that as well. But with a disease that the intermediate host is a bird, they have especially migratory birds, they have a very wide range. And so it can kind of the chickens come home to roost, so to speak, to use an appropriate analogy. So can you comment a little bit on H5N1 and maybe some of the factors that make that a One Health concern?
Sure, yeah, absolutely. I think we've been really, I guess, fortunate or unfortunate in that because it's been happening a lot in California. We've been hearing a lot about it. What is happening is exactly what you're saying. It looks like it's migratory birds that are transmitting the disease and bringing it in, which was very interesting because when was it? When did it start? A couple of years ago, right? Um, what we were seeing is we were seeing a lot of these farm workers starting to get it. A couple of cases of these farm workers getting it that were working on these production farms, where these chickens were getting H5N1, and they're getting it. They were getting it from migratory birds, and because of I guess it was just the mass amount of infections that were happening in these farms where they were getting transmission to these workers. And I think ultimately what's happening here is, you know, because we didn't have a good sterilization protocol in place or a good, what's the word I'm looking for? I guess a zoonotic protocol in place because it was still so new. The actual, what's the word I'm looking? Oh my gosh, I'm losing my words. The
Eradication? Yeah,
yeah, like
management. Yeah.
medication or eradication processes or sterilization processes weren't put in place. And unfortunately, there's a lot of turbulence right now within national disease control centers and even within state disease control centers. So I think when H5N1, particularly in the past last year when there was a big when we had a big kind of population or spread of it, we weren't able to get a national protocol in place quickly enough. And so because of that, there's a lot of confusion happening. And I think we lost a lot of flocks because of that, unfortunately. Unfortunately, what happens is if H1N1 is identified in a flock, it doesn't matter whether you're talking about 10 birds or 100 or 1,000, that flock needs to be culled. So you're losing a lot of birds in a very short period of time, which can decimate an industry that relies on regular egg laying or regular poultry meats. And a large percentage um, of eggs occur in California. So that was kind of why we saw egg prices rise so drastically so quickly, because you're losing sometimes flocks of 4 or 5 thousand birds at once. And so, now you're talking about a loss of life, animal life. You're talking about infectious spread, whether it be, through the infection through the birds or whatnot of farm workers. And then you're losing production. You're losing meat and eggs that are necessary to spread throughout the country for feeding our population. And so it's a great example of how one virus that perhaps was not properly contained quickly enough can kind of decimate multiple layers of a community very quickly.
Yeah, and I think that, one of the concerns is that, well, then how did the dairy cattle get it? But it seems to be it has a predilection for mammals, uh, thankfully, and humans can get it, of course, but we don't have human to human transmission
No,
yet.
yeah.
And that's sort of the scary step. But I think it speaks to the importance of close monitoring and communication between all these different aspects of One Health, such as agriculture, industry, public health, which that's a whole other topic, but and veterinary and human medicine. So it's the vigilance of the individuals that make up those organizations, and often it's just somebody who's thinking about it. We had one of our interns at Huntington Hospital diagnosed the very first homegrown dengue fever here in Pasadena, and she just happened to had read about dengue. A patient came in that sort of had some symptoms who had never been out of the country, and sure enough, that patient had dengue fever, and probably because of an Aedes aegypti mosquito, they can also, they're big dengue carriers here. So it's just the vigilance of individuals, but also the kind of hopefully cohesion and communication between larger organizations that are so important, I think, with this concept. So, um, but yeah, so I think that, right. So, I mean, in terms of the totality of it, the developed countries think we have sophisticated monitoring systems. Maybe we don't. But how does this kind of information get sort of transferred and placed in countries that don't have as many facilities? And I don't know, maybe Michelle might be speaking to that in the next sort of segment. I don't want to steal anybody's thunder here.
I think ultimately, that's one of the things that we noticed when we were in Tanzania. And Michelle is going to talk a little bit more about it because she was there most recently. Using Tanzania as an example, kind of internationally, that's the country that I have the most experience with using with diseases. Tanzania, for example, has a very, very rich and diverse ecosystem. They have a coast, and so they have beautiful wetlands and then very dry arid desert. And because of that, because of the very diverse wildlife around there, we can see a lot of indirect and direct human and domestic and wild animal contact. The problem with countries such as these developing countries is exactly what you said. The infrastructure is the problem. And so, when you have very rural villages, there's a lot of risk in that area for human populations to come into contact with these diseases that are carried through this wildlife or carried through a domestic animal that maybe is roaming free. I will say, however, the public policy in that country is starting to change. In 2015, they had their very first One Health, I guess a protocol. Let me see what's the exact name of it. They had the Oh, I have
Adopting
it
One
here.
Health,
Wait, hold on.
one, yeah.
So it is the National One Health Strategic Plan. So there is public policy that is out there that they have that and that was created in conjunction with a number of different universities. So Coin University, which is where they have the One Health Master's degree, what helped to kind of create this. So they're working towards it, and I think that that's one of the more positive aspects of this. I think One Health, the concept of One Health has become almost more popular vernacular. People are starting to understand it. I think people are starting to hear it more in everyday life. And so I think there are countries out the country these developing countries out there are starting to at least try and take it seriously. The big problem again is infrastructure, though. You know, there are not enough boots in the ground to be able to on a day-to-day basis, kind of promote and you know erect and or cause effect with these protocols. So that's on the public policy level. Now, that being said, I do think that there are the kind of boots on the ground on a more interpersonal level. I think you know we've met them when we've been in Tanzania, individuals who are committed to working with animal health, helping animal health, you know, promoting animal welfare, but on the other side, also making sure that they're putting in practices that also protect the human population around them, the villages, the rural villages, the people, the community around them that maybe are not quite educated enough in these practices. And so, you know, our 2018 trip was highlighted by that. We were able to meet Jens in 2016, who Michelle will talk extensively about for Umwawa, who does you know large spay neuter clinics and rabies vaccine clinics, and those are all designed to protect public health, decrease bite wounds or trauma wounds, as well as decrease the spread of rabies. And then Erasto, sorry, from the Donkey Project. Who is dedicated to promoting the animal health or animal welfare of these donkeys, but in a way that the community it becomes very palatable to the community. You know, working on farrieing services, teaching them about husbandry, things that will make these donkeys, these pack animals, more efficient for their owners, but also in turn promoting their health, promoting their well-being. And so while public policy is there, implementation is lagging behind, but I do think that there are individuals out there that are making a difference.
And I just wanted to add one statistic. Thanks, Diane. That was surprising to me, and actually, in a good way. Well, the statistic is bad, but you know, in the United States, we have between 1 and 3 deaths by rabies each year. In Tanzania, by comparison, they have 1,500 deaths by rabies. These are mostly in underserved areas, mostly children, unfortunately, that don't have access to the post-exposure vaccine once they've been bitten by a rabid animal. Sometimes they even have a strong suspicion that the patient probably has rabies but can't do anything about it. The good news is that the Tanzanian government has recognized this as a problem and has created a program that's been endorsed by the WHO called 0 by 30, wherein they're trying to decrease the amount of rabies deaths by half by 2030, and then obviously with the ultimate goal of eliminating the disease altogether. So the government is doing their part to try to protect the children. I think as veterinarians, it's our responsibility to protect the dogs and cats if possible. Dogs, though, most importantly, I'll talk about that in a little bit, because that helps protect the community and the children as well.
Yeah, and I think that one of the great, you know, things about Tanzania is that this is a country whose tourism depends on people coming to see the beautiful scenery and perhaps more importantly, the beautiful wildlife. And I think that both of you will probably touch on a little bit on some of the interfaces between wildlife in Tanzania and then the local animals. But I have been impressed with the efforts that Tanzania has made in recognizing the importance of communication between the different layers of healthcare throughout the country and sort of their interest in promoting and growing programs such as veterinary medicine and really incorporating that more into the kind of conventional healthcare mantra that I think is important in all countries. And perhaps in some respects, I think they might even do a better job than we do here in the United States. I think it's changed a lot in the US, but it does, that I think it was for a long time sort of, medical doctors were in their little silo and the vets were knocking at the door saying, hey, what we're doing here is really impactful on the people that you're taking care of. And finally, I think in the last certainly few decades, that's really become part of the realization that One Health is important. So, okay, so Michelle, you want to take the ball and roll here, or?
Yeah, sure. Wanted to thank you for giving us this opportunity. We're really excited to talk about our work in Tanzania. To clarify, we visited a town called Arusha. I shouldn't say town, it's a big city. The third largest city in Tanzania. The population is 620,000 people. And conservatively, the government estimates that the dog to human ratio in Tanzania is 20 to 1. So you can imagine 600,000 people times 20 dogs. That's how many dogs are walking around the neighborhoods. It's unavoidable for there to be contact between the people and dogs, and therefore it's so important for us to make sure that these dogs are protected against rabies. On our 2016 trip, our first trip with the Phil Simon Project, we had no idea what we were going to be doing or how we were going to be doing it. We did knock on some doors. Most of the veterinary hospitals in Tanzania are run by the government. And while everybody was super receptive and kind, they really didn't know how we could help until we met a gentleman named Jens, who is a German expat living in Tanzania. Here's a couple pictures here's a couple pictures from our 2016 trip. This picture in the center is one of the local government run offices. These were a litter of puppies that were getting vaccinated. Diane, I think you were going to talk about these slides a little bit. Do you want to chip in?
Yeah, sure. I mean, it's exactly what Michelle was saying. We had no idea what we were doing. Kim gave us this opportunity to go to Tanzania and see what we could do. And we landed there and we were like, what do we do? And they were very kind. The Phil Simon Clique was very kind. They gave us kind of carte blanche to walk around, gave us our own car and let us figure out what we wanted to do. And so we probably landed in some places we were not supposed to be in. Walked into a lot of different places that maybe we shouldn't have been in. And I will tell you, the Tanzanians are just so unbelievably welcoming. Once they heard that we were there from America and we just wanted to see how they did things and see if maybe we can put something together, everyone just kind of welcomed us with open arms. So this is Dr. Onesmo. He actually was a relatively new veterinarian in Tanzania, and we didn't know this at the time, but Tanzanian veterinarians, the government jobs, their focus really is on kind of like primary preventative care. So Onesmo found out that we were veterinarians from America and let us in, and this is us standing in there, watching him vaccinate kind of cute puppies. Um, that was the focus of veterinary medicine, at least at that point in time, at these government offices, mainly rabies vaccines and the like. They very rarely did any spay neuter or any other kind of major treatments. It's the same thing in human medicine in Tanzania, where they had these like clinical offices where people could come in and get medications if a pet were doing poorly. But you can see with this poster on the left, rabies was a really big deal even back then, or even in this preventative office. And so, we were able to go into these kind of places and meet people, and we actually continue to talk to Dr. Onesmo to this day. You can see at the bottom left, Michelle is doing the human interface portion of the One Health process. I think she was giving out candy to the kids at that point. And we were able to visit some Maasai villages and see their cattle, which they use a lot of times as currency. And that actually helped us for our 2018 trip to help organize our large animal portion. So definitely it was a great kind of fact-finding mission for us. And I think Michelle will take it here and talk about Jens.
Awesome. Yeah, so we met Jens in 2016. His goals aligned with ours. He had moved there several years prior, and 3 years prior to our trip, he had established Umbawa Africa, which translates to Dogs of Africa. He had noticed the animal welfare issues, the doggy overpopulation problems, and he wanted to do something about it. At the time, it was a budding rescue organization, and we promised that we'd come back in 2 years to do a spay neuter project. He was trying to recruit veterinarians from all over the world to come do spay neuter, and our goals aligned perfectly. So we decided that we'd go back in 2 years, and we kept our promise. We did. We went back to Arusha with a group of 11 veterinarians, and two of whom were large animal vets. Do you have a slide of pictures about that, Diane? I think. Yeah, so this is Dr. Shane working on a donkey. I don't know much about donkey medicine, but I do know that donkeys are very important to the population. They're beasts of burden. They carry a lot of weight around, and so the large animal folks went out into the field and did a lot of work on their teeth and their hooves. And they also have they had some skin lacerations from the ties that bound their stuff to their back. So, and a lot of education. I think they were there to teach other people how to trim hooves and do all the stuff you do to donkey teeth that I don't know how to do. But what's that? Oh, do you
Oh
have?
no, no, I was gonna say, you can see here at the bottom picture, Dr. Shane's focusing really on education. He's teaching these kids about donkey anatomy and how things work. So he spent a lot of time teaching these guys kind of basic donkey husbandry.
I will say that the donkey clinic, which was held at a donkey watering hole, was the most popular venue for that trip. We had 61 people on that trip. And half the time I was trying to wonder where I was wondering where my residents were, and they were off at the donkey clinic instead of the human clinic. So, but it was a really interesting opportunity. It was at the request of Jane Goodall that we went and did that with the donkeys because she was very concerned about, so how they were being taken care of or not. So it was really a very honorable thing to do and a pleasure to do it. And it was fun. And donkeys can kick sideways. You got to watch out.
Yeah.
Well, on the other side of town, the rest of the crew, there was 9 small animal vets and veterinary support staff. We provided a spay neuter clinic and a vaccination clinic. We set up shop in the middle of this large field in an abandoned building that we turned into sort of a MASH surgical unit. Here in the middle of the photo, you'll see Diane and I with Jens and Naftal, his trusty technician. The picture on the upper left-hand side is essentially the field that we were working in. On the upper right-hand side is the surgical OR that was set up. We were using like pool floaty rafts to keep the dogs upright. On the lower left is a picture of the intubation anesthesia area or the anesthesia area. It was very, very interesting and fun. On the lower right is a picture of where we recovered the patients. They would like, as soon as they were able to stand up, they would just go home with their owners. We were able to sterilize 157 animals on that trip, which we were proud of that number to begin with. But later on in the day, Dr. Schreiner pointed out that really that extrapolates out to a huge number. Of the 157, approximately half were females who would have gone on to give birth to more females who would have gone on to give birth to more females. So in effect, we think we prevented the birth of about 30 to 40,000 animals over the course of 5 to 6 years. So we were pretty proud of that. In addition to that, we vaccinated 427 dogs, I believe, against rabies, and we dewormed them as well. The project was so successful, we were so excited about it that we promised to come back and do it again in 2 years. However, the next trip was scheduled for February of 2020. Unfortunately, we all know what happened then. The world shut down. It took us a minute to get back on our feet. In the meantime, I'm proud to say that the Phil Simon organization changed course because we had to adapt. But we did want to keep our promise to Jens, so we went back in 2025 with a group of 6 veterinarians this time. Unfortunately, we were not able to provide a spay neuter clinic for Jens, but we found something that was astonishing in the best way. In the 7 years since we'd been gone, Jens had, with international donations, purchased a very large piece of land and set up a proper rescue. His land now has multiple buildings on it. He has an intake center where the pets are brought in as strays and kept to make sure they're not sick. an isolation ward so that patients who are sick with communicable illnesses don't contact other dogs or humans potentially. He has a cattery. At the time that we visited, there was a cattery with, I think, 34 cats. He has over 100 runs. At the time that we visited, he had 114 or 114 strays in his care. And he had a surgical room at the time where he was able to perform 70 to 80 spays and neuters per month. So you can imagine the impact he's making on the dog population in Arusha. Here's some pictures of our vet crew. The picture in the upper middle is the whole group with Jens and David Jr., who I'm going to tell you about in just a minute. Here's Jens there's a picture of Jens very proudly presenting his statistics. Last year he vaccinated something in the order of 7,000 dogs with rabies vaccine in Arusha. On the bottom left is a kitty cat in the cattery. There's one of those photos is of a woman who's doing physical therapy on one of the paralyzed dogs. He has a lot of volunteers that come in and work every day. The lower right-hand side is a dog that had scabies, which is a communicable illness to other dogs and people. It's a skin condition. He was growing his hair back. We weren't allowed to touch him, but he was really cute. And if anybody wants him, I will find a way to get you a health certificate to bring him over here from Africa. So we had a really great time. We were excited about it. Yen's goal, there was one really heartening moment while we were there. There was a little kid. He couldn't have been more than like 6 years old as we were driving in. He was walking up the driveway, and in one hand, his puppy is dangling, and in the other, he's holding a yellow vaccine card. He had come in to get his dog vaccinated, which just shows like how far Jens has come in educating the community there with regards to how important it is to keep their pets safe. Because when we first went in 2016, most of the dogs were kept for protection. They were owned either as household pets or as neighborhood pets, but oftentimes used for protection. But we're hearing more and more about how pets are sleeping in beds with their children now, which is such an awesome transition. I'm sure most of us can understand the desire to do that. And we think it's really cool that Jens is working toward that goal to make it possible and safe for the children there. Jens has two, well, we have two primary goals we'd like to work with Jens on in the coming year. One is continue to help him with the help of the Glide Family Foundation. We've been able to fund some of his vaccine efforts in the last year. One big project for us and for him, we'd like to set up a training facility, essentially he did just build a low-cost veterinary facility on his property as well that services the entire community. It has an enormous operating room with, I think, either 6 or 8 surgical tables, and these are to be used to spay and neuter dogs on a daily basis, but also we'd like to get a training course together where he invites veterinarians from all over Tanzania to come in and perform spay and neuter. That's something they don't learn to do in school. So he'll teach them, and then they can go back to their respective neighborhoods and spread the wealth over there, and help with population control in the smaller, like more rural areas. So we're excited about the work he's doing and the work that we get to do with him. And if you guys have any questions about that, we'd be happy to answer it. He does take donations. We will provide his website for you.
That's terrific, Michelle. And I think that the importance of engaging the local community and the folks that are around that area is critical, I think, to the success of these small endeavors that grow into large things. And you're absolutely right. For every dog that's vaccinated against rabies, that protects I don't know how many children from dying from rabies. So I think it has direct impact in our country as well, of course, with the same interventions. So it's really wonderful to see individuals that are this committed to that. So one of the things we've been very proud of, and this certainly, as Diane alluded to, during COVID, since we couldn't go, we had to really transition to supporting our scholars and recruiting more scholars to human medicine physicians, but also we opened our scholarship program to veterinarian. I think you guys are going to now talk about that. Is that right?
Yes.
Okay.
So I know that I think most people here probably already know the mission or the goals of the organization have changed a lot since 2000 when we first started going and just seeing patients there. Now we've transitioned mostly to offering scholarships to worthy individuals who, in the fields of, MD, doctor of medicine, nursing, social work, midwifery. And 2 years ago, Diane and I were asked to join the scholarship committee in order to, and tasked with the responsibility of finding a veterinarian to put through school essentially. And oddly, it was a big ask and a difficult task. We reached out to Jens to help us, and once again, he came through. He had a friend who's a professor at the veterinary school there. The veterinary school, as Diane mentioned, is the Sokoine University of Agriculture. It's the largest agricultural institution in Tanzania. It was formed in 1974, I believe. That's when the vet school was formed. But in 2018, they started a Masters of One Health, which we didn't know about, and Jens educated us about. And the cool thing is that most of the applicants for the Masters of One Health already have their veterinary degree. So we interviewed 4 applicants for the Masters of One Health position, and one standout scholar named David Jr. really just caught our attention. I mean, he was knowledgeable, passionate, and his goals aligned with ours. He's interested in One Health. So we awarded him the scholarship. He started school in October. I should clarify that. The Phil Simons organization awarded him the scholarship. He started school in October. It's a 2-year master's program. And we are very excited and proud to be on this journey with him. He needs to come up with a research project, execute it, and then write about it or present about it. And it sort of intersects with our new goals as well, since the Phil Simon organization is also cooking up some potential research projects that we're excited about too. So we don't know yet if he's going to stay in private industry versus work for the government, but we do know that he's indicated a strong interest in staying in his country and using his degree to further One Health in Tanzania, focusing on disease prevention, public health. And we're really excited to watch him grow.
One thing that's very nice is that Boniface Petro, who is on tonight, Boniface is our current medical student who's in his 4th year of medical school. He and David Jr. have been communicating in a project that we're really excited about starting. As Michelle mentioned, we're interested in moving forward with some research projects, looking at the issues of interactions between wild animals, domestic animals, and humans. And so the last trip when we were there, we were beginning to put the pieces together. A pesky little hemorrhagic virus prevented us from going this year, but we still, because we have such a wonderful crew on the ground in Tanzania, we've been able to kind of mobilize this and move this forward. And one of the things we're looking at is the prevalence of antimicrobial resistance among bacteria in the stool of wildlife. That actually is a very interesting topic these days, and is something that is being done throughout the developing countries and developed countries, frankly, where we look at the emergence of bacteria that are resistant to antibiotics. And what's sort of mind-blowing is that we are seeing the issues of antimicrobial resistance in animals that have no contact with humans, and wildlife that have no contact with humans. So this is a very, very interesting factor, because we've long thought that the major driver for antimicrobial resistance was the overuse of antibiotics, especially in developed countries like the United States. But in fact, it's probably much more complicated than that, and there may actually be reservoirs of these bacteria in wild animals that have no contact with humans or very minimal contact, but it's very impactful. So Dr. Junior and Dr. Petro are going to work together with another veterinarian we have from Vienna, and in conjunction with the Ngorongoro and Serengeti wildlife supervisors to look at the incidence of these bacteria in feces. And so it's really an exciting endeavor. We're launching our first research committee as part of our board in the process of doing that. And I think it's a very exciting time for our scholars and for those of us that are passionate about this kind of work. So I wanted to share my screen because I have the quintessential One Health picture here. You might recognize some of these people, Michelle. So this is Dr. Bausman. This is Michelle's fiance, and Lindsay back here, one of the other veterinarians that we brought on that trip. And this is Dr. Jonathan Pye, who is a very, very distinguished general surgeon from Wales in England. His father wrote the book on on human surgical interventions. And he was on that trip and he asked if he could come in and scrub in with the vets. And Michelle, why don't you tell the story about when Dr. Pai came to help you?
I'm sorry, Kim, my brain is turned to mush.
Oh, well, so I remember you said something like he asked if he could help, and you said, sure, come and scrub in. And he was, well, first of all, he was surprised at where the ovaries were in a dog, in a female dog. I think that was one thing that he was kind of surprised at. But I think you said something to him like, I think you've got this, as he was rummaging around. So you can tell that, he's in there with
Yeah,
Dr.
he did
Dawson.
an amazing job. Jerry did one side and he watched Jerry do the first side and then he just figured it out and got the ovaries and uterus out on the other side on his own, like
Yeah.
literally with no instruction. No one told him what to do. He just watched one and then he like masterfully spayed a dog.
So this little dog that was spayed didn't know that she had world famous surgeons operating on her, both the veterinary world and also the human world. So my point is that I think one of the great benefits of our trips to Tanzania, in addition to the wonderful people that we're sponsoring over there, is that you have this opportunity to travel. Spending 32 hours on an airplane with folks really is a good bonding experience. But you have an opportunity to travel to watch them work in their specialty and to have conversations and to talk about the differences between animal health and human health. And I think that it's really a wonderful way of sharing very important professions that really have a lot of impact on each other, but often don't converse with each other. So I think that's really one of the great benefits of what we've been trying to do, and it's a good example of really sharing knowledge. One of our vets that went in the very first trip scrubbed, she didn't scrub in, but she watched the surgery of one of our plastic surgeons, and she learned all kinds of new surgical techniques to remove tumors from animals without leaving a gaping hole. So again, these sort of simple things that you can kind of pick up from somebody else, um, I think is really amazing. And I know that Dr. Pai really treasured the day that he spent rummaging around in that in the dog with Jerry and
He
Michelle.
was talking about it all night. He was so excited.
Made his whole day. So, um, okay. Any other comments or things you wanted to point out, Diane and uh, Michelle?
I did want to say thank you for giving us this opportunity. It's like super fun to share. I mean, Africa, as everyone that knows me knows that our trips to Africa have been a really big part of my life. And the fact that we're on the scholarship committee and I'm on the board, it means a lot. So thanks for letting us share.
Well, we're honored to have you all. It's really been a treat, and I think it's a wonderful experience for everyone. So we're happy to open up to any questions that people might have. You can put it in the chat, or you can, Ariel, if you want to go ahead and unmute people, we can raise your hand if you're skilled at that in the Zoom world. Anybody have any questions? Is all perfectly clear?
I just had one comment.
Uh-oh.
Oh,
You
Dr.
guys don't know this,
Bosman.
but that's
Okay.
Dr. Bosman, who is Dr. Zorian's fiance and also a very influential member of the veterinary team.
Go for it, Jerry.
Oh, well, I guess maybe more than one comment. One is, yeah, it was a really great experience with Dr. Pai. Being able to, stand over that dog and kind of talk about the anatomic differences between people and dogs, and share my knowledge with him, but also, get some of his knowledge too. Because tissue is tissue and tissue handling is the same, whether you're in a dog or a human. The other thing that I remember happening too, though, was one of the nights at the lodge. I think somebody brought in a child who had a heart murmur, and we had a veterinary cardiologist with us, and who was very adept and good at echoing small hearts. But he's also really good at using not the top of the line of equipment, because oftentimes in veterinary medicine we don't have the top of the line equipment. So he was able to echo this child and find their anomaly, which helped out with the group too. And that was just one of the great things about this whole experience is being able to work in concert with the human side, as I like to call them, human veterinarians. And and be in an experience where one isn't thinking or considered better than the other because of the medicine they practice. It's just medicine all the way around. But the last thing I want to say is that picture is it's awful to see because we're standing over this open dog and we don't even have a hat or a mask on, and that's just veterinary surgery in Africa and Tanzania. That's not how we always do it.
As an infection prevention doctor, I just sort of will give you a pass on that one, Jerry.
Yeah, thank you.
But I do recall the evening after you'd spent the afternoon with Dr. Pai, you had a little bit of a British accent. I did notice that.
Yeah.
We're really pleased with this presentation, and we hope that if you don't know very much about the Tanzania project, you can go on our website and learn more about it. And if you want to see some of the previous speaker series, including a wonderful interview with Jane Goodall, please take a look on the website and you can see those in totality. So thank you very much. Have a wonderful weekend, and hopefully we'll see you in April for the next one.